everyone, welcome back to my channel Fetal Insight, where I share my experience as a fetal medicine midwife in Zimbabwe. My name is Future. I am a nurse midwife currently based in the UK, practicing as a registered nurse. If you are new to this platform, welcome. I would like to refer to this channel as a safe and wonderful platform. I advocate for best modern practice to manage fetal health. Today we are going to discuss about common fetal health issues in an unwell baby or in an unwell fetus. The baby is in utero but is not feeling well or is not growing well or has been affected somehow. However, before I actually define what common health issues are, I would also like to bring into attention that common fetal health issues, they are also most part of fetal medicine is important, because the fetal medicine is the only important department or unit which can help to manage common fetal health issues or to manage unwell babies. Okay, coming from a controversial community whereby religiously or culturally there are some dilemmas about birth outcomes, you'd find that culturally people believe that there is witchcraft when it comes to birth outcomes, and they can as well religiously people think it could be a curse from God. However, it's the same person with culture background and also with the religious background and who is now integrated in fetal medicine. And I'm seeing that fetal medicine is the best modern way for the community to understand common fetal health issues or to understand unwell babies or to understand birth outcomes, either normal or the unfortunate part of birth outcomes. So let's help me guys to welcome again fetal medicine into common fetal health issues. I might not be able to put it across today in this discussion, but however, it's going to be one of those major topics I'm going to address after the fetal development presentation. To each part, each trimester, how is fetal medicine important? How do we detect an unwell baby? How do we manage an unwell baby? What are the delivery plans for the unwell babies? So stay tuned and let's learn together. Common fetal health issues. What are common fetal health issues? We are talking about health problems or fetal health problems which might arise during pregnancy, and this might affect the growth or the developing fetal's health or the baby's health, meaning to say it's a baby who has been affected, who has become unwell whilst in utero. This might affect the growth or the development of this baby. When this happens or when this is diagnosed, what is the best modern way to manage such conditions? We say there is need for additional monitoring and treatment during pregnancy. And then when you say these babies needs to be monitored or there is need for additional monitoring, how best can we monitor? It's quite obviously that only a fetoscope cannot detect or assess or manage the condition of this baby. Secondly, even a Doppler, a fetal Doppler, cannot manage the baby without some assessment. Thirdly, even only a CTG cannot monitor this baby effectively it would need some integration of high machines, ultrasound scans from fetal medicine to assess the baby from head to toe, to actually examine the baby from the brain part, from the Doppler part, meaning to say how is the blood flowing into this baby's brain, into this baby's heart, into this baby's liver, how are the limbs of the baby, how is the heart of the baby. Every part of the fetus will get examined. This is what we term additional monitoring. And then we are examination of the baby. We need to examine the fetal heart rate. How is this baby? We need to examine the fluid covering the baby. Is it adequate? We need to check the placenta position. We need to check the healthiness of the placenta itself. Doesn't it have infarcts? Is this placenta sufficient enough to feed this baby? Or even exchange of blood gases. So it's a whole lot of additional monitoring. And then when we talk about treatment, sometimes we can tell that there is maternal infections which needs treatment. We can tell this baby is affected and mother can undergo some treatments, can get some medications, can get some management plan or some delivery plans that this baby needs to be out as soon as possible. So this is part of the additional monitoring or additional treatment. Meaning these are special babies which needs or demand special care, and this special care can only be found in departments or units like fetal medicine. So whenever as a mom you are told your baby is not well or your baby is some conditions, I am empowering you, regardless of the midwives, doctors sharing more information with you, that no, there is need for additional monitoring from modern or best practices in pregnancy management. I would like to bring to your attention that all pregnant women can access and they are also eligible for fetal medicine care. Whenever your baby is unwell, you are eligible and you can access fetal medicine care. All right, what is it that we term an unwell baby? What are these common fetal health issues? I'm just going to list common fetal health issues, and then I shall dwell on each of the common fetal health issues in the next presentations, because these are the core for fetal medicine, and each common health issue or each condition has got particular management in fetal medicine. However, today let me just try to give you a list of some of the conditions which we dealt with in fetal medicine. I would start with fetal defects. Birth defects affect any part of the body, and these are physical or biochemical changes present at birth. They might affect how the baby would grow or how the body of the baby would function. These conditions usually affect any part of the body: the brain, the face, the spinal cord, the heart, the limbs. Any part of the body of the baby can be affected. Let me also bring into your attention that there is management for fetal defects. It depends by severity or the part of the body affected. Fetal medicine would help any pregnant woman with some fetal defects with proper, appropriate management. Secondly, we have chromosomal abnormalities. These are conditions caused by when we have either a copy, an extra copy of some chromosomes. I don't want to be into these signs of how it comes about, but to bring to your attention that we have some chromosomal abnormalities with conditions like Down syndrome, Edwards and Patel, among many conditions. We would also discuss in depth when I would discuss about the chromosomal abnormalities. But these are some of the common health issues which affect the fetus. Conditions like fetal growth restriction, whereby the baby is growing at a lower or slower rate than expected. This might be caused by maternal conditions like maternal malnutrition or placenta disorders. So when the placenta has got some issues, the baby might not grow well. And if they've got some malnutrition, the baby might not grow well. But I will deal again in depth with this condition. Fetal medicine would help to diagnose and help to treat or manage these conditions. We can have either agent delivered if it means this placenta is no more at all contributing anything for the baby to grow, or there could be some serious scans which I termed additional monitoring. A baby can suffer from fetal anemia. Fetal anemia can be diagnosed through fetal Dopplers, and some management can be given, or serious scans can be done to see severity and how this baby is coping. We also have conditions like oligohydramnios, whereby the fluid which covers the baby will be lower than expected, meaning to say this baby needs close monitoring, because sometimes when the levels are lower than expected, they might even cause some fetal deformities because the baby will be squashed. So it's something which needs ultrasound scan monitoring and to check how best this baby is growing, or the best management plan for the baby. We have conditions like placenta disorders. This might be caused by conditions like high blood pressure, what we term preeclampsia in pregnancy. These conditions altogether are part of the common fetal health issues. We also have maternal conditions which might affect how the baby can grow. When the pregnancy is not on the proper position, it might cause that baby to be expelled. We can have miscarriages, we can have ectopic pregnancies. All those are unfortunate maternal conditions which would affect the growth or development of the fetus in utero. We also have maternal diabetes, what we term gestational diabetes. This means mom has got diabetes in pregnancy, and this affects the baby. Baby might be bigger than normal, what we term macrosomia, or we can have a baby affected with heart problems just because mom had the gestational diabetes or had chronic diabetes. We also have conditions like preeclampsia, when mom has got high blood pressures in pregnancy, and this affects how the baby grows. All these conditions can be managed in fetal medicine. We also have conditions like maternal infections, whereby mother can be affected by toxoplasmosis, or we have conditions like CMV, cytomegaloviruses, which would also affect the growth of or development of the fetus if mom is affected. So these conditions should be treated in fetal medicine. This is where part of treatment is also coming in. We need to know what are the causes or risk factors of these common fetal health issues. I'm just going to list 4 major causes I've picked. Number 1, there is genetic factors. Secondly, we talk of environmental factors. Thirdly, we'll talk about maternal infections or certain infections affecting the fetus or the mom. And fourthly, we'll talk about maternal health conditions. And some of the causes are unknown. They've got unknown origins. We now have causes or risk factors, but how best can we diagnose these babies? Ladies and gentlemen, we need to entail or to integrate prenatal testing in our management of pregnancy, because you can have definitive diagnosis of what's affecting the baby. Number one, ultrasound scan can help. Secondly, investigations like amniocentesis can also help to have a definitive diagnosis. We have also non-stress testing as well as fetal heart monitoring. These help to have a definitive diagnosis, and it would help in management of the fetus. Okay, how best can we manage this fetus? Management of common fetal health issues depends with cause or severity. Some may just need close monitoring. That's the use of ultrasound scan checking on the baby's progress or well-being. Some might need maternal change of medications, either preconceptionally or in early trimester or during the pregnancy, depending by how the baby is being affected. Some might just need some dietary changes. I've mentioned before about maternal malnutrition. It means this mom would need balanced diet. And also, I've talked about patients having a delivery plan either unexpectedly, but due to the severity of the condition, mom is told baby should be out as early as possible. And other babies might just need specialized fetal care, and this can be rendered by fetal medicine midwives or fetal medicine specialists. This means this baby is highly monitored due to the conditions I've just said, due to causative or the severity of the condition. This is how best we can manage common fetal health issues. Next time, I'll talk about each common fetal health issue and how best it can be managed in fetal medicine. So most of these conditions are the causes or the call for fetal medicine. This is what we use to deal with almost every day in fetal medicine. And I'm saying now we have a picture of the conditions which are managed in fetal medicine. Let's go or work together in this journey of showing how fetal medicine is important in our fetal health care and why everyone should embrace the new. I understand most of the people are not familiar with fetal medicine in Zimbabwe and they are not sure where to get these services. We are saying it's now available in the government sector and in the private sector. And every pregnant woman is eligible and must access this kind of care at a point. It's not all about just fetal medicine. It's a lot which I need to explain to everyone to understand and to know that fetal medicine is of great importance in management of pregnancy. When we talk about trimesters, the first trimester has got a lot to diagnose, has got a lot to prevent, has got a lot to manage the subsequent reviews of the pregnancy. When we talk about second trimester ultrasound scan, it's a lot which is detected from the anomaly scan, how your baby is doing, is your baby well, is your baby unwell, how best can we manage in subsequent visits. And when we talk about third trimester, it's a whole lot of what's also happening to the baby and proper management to be given. This is where we have a delivery plan. We can have procedures like echocardiography being done and multidisciplinary approaches finalizing on how to manage your baby. So it's a whole lot that happens in fetal medicine. For the best care of your baby, individualized care is offered. I'm also going to talk about informed consent. What do we term informed consent? Because all these activities do not just happen by force. No, you need to consent to every procedure to be done to you. What I'm still trying to bring about is a good and a pure understanding of why fetal medicine is of great importance, management of pregnancy. Thank you very much for listening. Don't forget to share, to subscribe, to comment, and to like. Thank you.